I really don't know what to say. I guess I'll wait for Rod Serling to come through the door, but
that would be the second coming of Rod Serling, I think. I think he passed away.
the way things have been going here, I wouldn't doubt it. I mean, I could see it happening. This morning, according to Politico Pro's whiteboard, Senator Tom Harkin blasted HHS Secretary Kathleen Sebelius at a hearing this morning. It was after we had started this hearing. Blasted Sebelius for using prevention fund money to pay for insurance navigators, saying the Obama administration is treating preventive care as an afterthought. To quote the senator, "I'm sorry to say this administration just doesn't get it." And this is a Democrat. This is not the Republicans' drumbeat. First of all, it was a $5 billion raid last year on prevention funds, Harkin said, referring to the payroll tax extension President Barack Obama signed into law last year that cut $5 billion from the prevention fund. This year, it's another $332 million raid. It's sort of like the prevention fund is sort of an afterthought. I'm going to ask you one more time. Do you agree with Senator Harkin that this administration should not be raiding the prevention fund for funding exchange expenditures? Yes or no?
You know, I would have been happy if Congress had appropriated funding for us to do the work that we need to do, and you know that didn't happen, and so the Secretary made decisions under her authority, and I don't have an opinion one way or the other as to those decisions. No.
Who would you direct me to? Let's say for a minute that I have staff that come to me and say, we're a little confused. What's our health care going to cost starting 2014? What government agency would you direct me to get their questions answered, what they're going to be paying for their health care next year? My staff.
Well, if your staff is covered by the federal program, then I think the information that they would want to get would be from the program that administers health care.
What government agency?
FEHB or whoever, whatever coverage they have.
OPM, maybe?
That could be.
Well, we have tried relentlessly because I have, well, you laugh at it, but
no,
my staff's not laughing. And it's a very serious concern for me when you have staffers on this Hill that have got college educations, some of them have law degrees, and they're living 2 and 3 people to an apartment because of the cost of living up here to get by. And they come to me with a legitimate question on what they're going to be paying next year. They're thinking about leaving government service. They're thinking about taking jobs other places. It's a very serious thing. So we have tried to get the answer on what they're going to be paying. OPM cannot tell them.
No, and I mean to minimize it, Congressman. I was only smiling because I can't help with OPM, obviously. I wish I could, but I can't.
I gave Rod Serling 5 minutes and he didn't make it, so I yield back.
Gentleman's time's expired. And recognize the gentleman from North Carolina, Ms. Elmer, so 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Cohen, for being with us today. I do have to go back and just reiterate some of the points that have already been made and just get some clarification from you. One, going back to the closing of the pre-existing insurance coverage. Now, it's April. When was that closed?
It was closed for the federal program in February and for the state programs in March.
Okay. And so those individuals who would be utilizing those dollars for their pre-existing condition coverage will not be able to do so until January 1st.
New enrollees, the existing enrollees are unaffected, but new people who would be coming into the program will not be able to come into the federal, into the PISA program unless we are able to, yes, until January.
As it is right now.
As it is right now.
Okay,
right.
You know, this is the confusing part about it because especially my colleagues across the aisle continuously try to paint us meaning Republicans here on the other side, as the ones who are interfering with anyone getting pre-existing coverage and looking at it from an unsympathetic standpoint. However, this program has been cut off. and they support that. And here we are attempting to pass legislation to actually help those individuals. I'm just
So are we.
there again.
Will the gentlewoman Leo?
This is my time. You had your time. I'm perplexed by that, and you clarified that for me. I just wanted to make sure that we clarify that we are talking about months of time that individuals will go without that care. Also, for clarification purposes, in the discussion that the discussion you were having with Mr. Johnson, and then also with Mr. Gardner, you stated that as of January 1st, 2014, that healthcare premiums will go down. Is this correct?
No, what I think I said, what I believe is that, first of all, we don't know yet what premiums are going to be for coverage in January of 14 because plans are just now submitting those rates to their state insurance departments for approval, to the exchanges with respect.
Okay, but sir, that was not the promise. The promise that was made continuously when this was being implemented was that healthcare premium costs would go down. And so I am asking you under oath today, as you see it, you are no longer standing behind that statement. You are now saying that it is that we do not know, and probably more than likely seeing healthcare insurance premiums going up. Is that correct?
No, that's not correct. What I think I said was that for 2014, we need to wait to see how the rates come in, and over time, I believe that the Affordable Care Act will result in a lower overall cost of
and what? Okay, sir, what do you base that on? Because CBO has done a culmination of studies which showed, and I'll just cite North Carolina, that North Carolina healthcare premium rates will go up by 61%. So what are you basing your data in? And if you do have studies that show this, I would like for you to submit them to the subcommittee.
I'm basing it on the increased competition that will exist in the new marketplace compared to what we have today, where in many states.
But that could exist with or without the Affordable Care Act going into effect. We in Congress could enact many, pieces of legislation and are working on just that to help increase competition amongst the healthcare providers.
It could, Congresswoman, but in most states today, in many states today, the individual and small group markets are dominated by one carrier that has 60, 70, 80, even 90% of the market. That's the reality today.
And that could be easily remedied. That could be easily remedied with legislation. We don't need this massive takeover of healthcare, increasing rates by 61% for those who I represent in North Carolina. There again, I would really hope that you would be able to gather some data, and again, under oath, saying today. So you are basically saying I am incredibly unclear as to what will happen with healthcare rates as of 2014.
For most Americans, the millions of Americans who are covered by insurance through their employer that's in a large group, they're not going to see an effect from the Affordable Care Act one way or another.
Okay, well, my time is up, and I don't understand even what you base that on.
If I could ask, gentlemen, you asked a question about, while he was under oath, if he said about prices going up or not going up, and you didn't get a chance to answer that question, so I'm going to give you a moment to answer that question. With regard to, it was previously stated that about prices not going up. You said you couldn't guarantee that. You were going to elaborate on that statement?
I think we lost the thread.
All right.
Mr. Chairman, let me ask. Mr. Cohen, did you ever say that...
Mr. Chairman, I think I'm next in the queue.
It is.
If you don't mind, before
I'd
you go
ask
to a second
unanimous
round.
consent to declare. Listen, the previous questioner advised the witness he was under oath and then asked him a question and refused to let him finish answering that question, and I think that is inappropriate for this hearing.
Well, I just asked
so,
you,
Mr. Chairman, I think that the witness should be allowed to complete his answer.
I just did that, and
Well, I'm not sure what the question was.
Right.
That's my problem.
Well, I will be more than happy to restate my question. If
And I
that
ask
will
you could
help.
submit that
I
question
think
for the record.
it is wrong for members of this committee to try to put the witnesses in a perjury trap.
That's
when
why
they,
I'm-
when they come in here,
No,
and
ma'am.
they're trying to help them.
Just want to let you know this hearing continues live online. cspan.org is where you can follow it. We'll break away